Ma'am, it's time. We can start now. Our
We
honorable
have
speaker and
16
chairperson are there.
participants. Yeah,
Yes.
but we have 16 participants. Shall I start now?
Definitely, ma'am. Time is there. We can start now.
Okay, okay, okay. Uh, Good evening and very warm welcome to one and all present here. I, Saima Ayub, moderator for this lecture series called Reflection. Reflection is a masterclass series in mental health, and the aim of this masterclass series creating a positive and enriching experience and to empower with the knowledge and skill development for scholars and professionals working in a field of mental health. The initiative of this masterclass series is taken by Indian Mental Health and Research Center, IMHRC, Lucknow. Now, with this, the topic of today's lecture, positive psychology, intervention in clinical practice. Today, we have with us as chairperson Professor Devrat Kumar Sir and for speaker Dr. Shikha Soni ma'am. Now, with this, I like to introduce our chairperson and speakers. As speaker, we have Dr. Shikha Soni ma'am, is an RCI licensed clinical psychologist with over 10 years of experience. She has completed her MPhil in clinical psychology from CIP Ranchi and PhD in psychology from Department of Liberal Arts at IIT Hyderabad. She has worked as a senior research fellow in a Department of Clinical Psychology at NIMHANS, Bangalore. She has published several research articles and book chapters. She has been a speaker and panelist at multiple domestic and international seminars and conferences. Currently, she is associated as consultant clinical psychologist with Doc Vita and Mindhouse. In addition to her private practice, she is also visiting faculty in Chanakya University, Bangalore. Very warm welcome, ma'am. Now we have as chairperson Professor Devrat Kumar Sir. Sir is professor in Department of Clinical Psychology, NIMHANS, Bangalore. His research interest area is perspective memory, cognition and schizophrenia, and forensic psychology and school mental health. Sir have received many awards and fellowships, such as R. Kishore Young Scientist Award of the Indian Association of Clinical Psychologists, and received Liverpool India Fellowship and Human Frontier Science Program and Fellowship. Sir also has number of research projects as a principal investigator, and with this many more research publications as research articles, manuals and book chapters. Welcome sir for today's lecture as chairperson. With this, now I like to invite, I just want to introduce our head of the department, Professor Zaidi sir, who is there with us for our encouragement. And thank you so much, sir, for joining us even prior the time and giving us the time. Thank you, sir. Now I like to invite
Thank
our
you very
chair.
much. Thank you, Saima. Thank you very much.
Now I like to invite our chairperson, sir, kindly chair the session. Over to you, sir.
Um, I'm really thankful. I'm always thankful when you people invite me, because from your regular work, this gives a kind of different perspective and an opportunity to interact with many people. Am I audible clearly?
Yes, sir,
Yes,
you are.
yes.
Okay. And when I came to know, when I was told that the topic is on positive psychological interventions, so,
এই যে
I'm really impressed with this topic.
কি হলো
The reason is that
এই যে প্যান্ট্রাইট মোমো আছে
some
Somebody is
sound.
opening their mic. Please close.
Yeah, the whole concept of positive psychological interventions started with Seligman writing that what we do is in the clinical psychology practice or in general in mental health practice, that we focus upon negative emotions. So we keep working on sadness, distress, and disappointment and all. We seldom work upon positive emotions, and that is why we are so bad in preventing problems. we are good at, when the person develops a problem. So positive psychological interventions have very important role in our life, and I'm really happy that this topic has been chosen. So now I invite Dr. Soni to start talking about that, and once she completes, then we can take up. Who is moderating the questions? I just wanted to know that.
Sir, I, Saima, you will
Okay.
moderate the session.
So yeah, then that's fine. So I invite now Dr. Soni to talk.
Thank you. Thank you so much, sir. And thank you for the lovely introduction as well. Okay, so I'll start sharing my slides. After that, I can take it forward.
Dr. Soni, please unmute yourself.
Am I audible now?
Yes, you are audible. Please go ahead.
Okay. 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 So welcome everyone. Thank you for joining. So the topic of today's discussion is positive psychology intervention in clinical practice. Okay. So first of all, what is positive psychology? I'll start with the very simple definition. Positive psychology emerged as a forum where scholars could explore the brighter side of human nature. As I think Sir has also rightly pointed out, that as clinician in the clinical practice, somehow a lot of focus has been on the negative side of the human nature. Somehow also, for example, in my understanding, in my clinical practice, as soon as a client walks in, most of the first thing which I actually ask, or I would say actually used to ask, that what are the problems, what are the concerns, especially that is again one of the things which I actually follow now as well. However, since I started practicing positive psychology, I will throw more light as I go ahead in that how I try to also look into the strengths. So one of the first questions that, what is the problem? What is the issue? What is the concern? And the session usually flows like that. The first session flows like that. However, positive psychology talks also about the brighter side of human nature, where towards the end of the session, I also like to ask, what brings you to the therapy room here? And despite all the problems we are going through, what is something which is actually working okay? Right? I can ask that simple question, which can look into the strengths of the people. So, strength based approach, which is positive psychology, it helps in focusing on helping people grow out of the adversity, and it also attends to nurturing what is best. That is one of the very important sentence given by Seligman. And this is again one of the definition by Peterson and Park, which talks about meta psychological level and the pragmatic level. This is how the positive psychology is also defined, that positive aspects of human functioning and experiences are very important. Along with that, understanding the well springs, processes and mechanisms which leads to the desirable outcomes. Like I already mentioned, it is a strength-based approach to well-being. It is a scientific study of well-being, optimal functioning, and human flourishing. It focuses on strengths, resilience, and the factors that enable individuals and communities to thrive. And it's also not about ignoring the problems, rather developing the tools and resources that sit alongside the traditional clinical approaches. Now, this is one of the things which I have noticed while practicing positive psychology, principles and methods and techniques into my clinical practice, that it is sometimes termed as toxic, positivity, or everything is termed as positive, or we are ignoring the clinical approaches. Let's say the famous, the widely used cognitive behavior therapy approaches. If we use kind of, only and only positive psychology and only CBT can bring good results, I would say we can integrate both of them. This is something which I am following these days in my clinical practice, that it can actually be used alongside the traditional clinical approaches. It is nowhere says that we have to use ignoring the clinical other approaches which are used traditionally. Other terms which which are displayed on the slide as well, that flourishing, resilience, they are very important terms when it comes to positive psychology. This is one of the example which I give to many people when I explain what is resilience. So if you can imagine, which is written in many of the books, like if you can imagine a spring, and if you bend the spring, and if you leave it, it will come back to its own shape. So this is how the resilience is, that despite having all the troubles, despite having all the challenges, despite undergoing lots of adversity, people still come back to homeostasis. People still come back to their own shape, which is actually termed as resilience. So what does positive psychology look like? It goes from what's wrong to what's strong, identifying and building upon positive emotions like joy, contentment, gratitude. Like in our traditional clinical approaches, we do focus on negative emotions, though also while integrating the different techniques, we do focus on the positive emotions as well. However, the emphasis is little less. But in positive psychology, the emphasis is given more on the emotions like joy, contentment, and gratitude. Gratitude is one of the very beautiful emotion, which is actually many of the techniques are defined on this emotion called gratitude. Learning mindfulness techniques to enhance the presence and awareness. Also fostering the positive relationship with oneself, others, and the world, which is again having strong community support system. And finding meaning and purpose in life. Well, positive psychology, again, you can find many commonalities with humanistic psychology. And in fact, Seligman started with the concept when he, the founder of positive psychology, started with the concept of learned helplessness, and later he founded positive psychology. So a lot of commonalities you can find between these approaches and humanistic. So what about positive psychology in action? So these are few of the real life examples of positive psychology. So for example, a person overcoming anxiety using mindfulness and focusing on their accomplishment. So many of my clients who, let's say, for example, someone is diagnosed with anxiety, lot of focus is on the symptoms of anxiety. Let's say they come with the complaints of breathlessness, fidgeting, hot flushes, cold flushes, lot of symptom intake, which I do with them. And the one of the first approaches which can also be used to help them at a very surface level is the widely used Jacobson progressive muscle relaxation, or any kind of important breath work. However, sometimes this is one of the things which I have found, which obviously what the theory says, that anxiety is always the outcome of also something else which is going in the background. And to also, in order to target that, in order to know that very well what is exactly going on behind, is very important. And then integrating few things and few approaches where they focus on their accomplishment. For example, gratitude techniques. I will talk about it more once I come to the particular interventions. Also helps them to overcome their anxiety. Another example can be a couple improving their relationship through exercises on strengths and active listening. Now in couple therapy, one of the things which is also, as soon as the first or the second sessions are done, lots of complaints are there. The self-blaming is there, but more than self-blaming, blaming each other is there. A lot of negative parts of the relationship have been kind of told off, that yes, the problem is this, problem is that, relationship is not working, etc. However, when two people came into the relationship, there might be some things because of which they started liking each other, or because of which this relationship started in the first place. So, digging out the strengths of the relationship sometimes is found to be very helpful. I at times start with very simple activity where I ask them to note down five negatives about their relationship and five positive about their relationship, and then converting those positive about their relationship into do you call these as strengths of your relationship, or to identify one of the biggest strengths of their relationship. One of the first thing again to start with, that if two people are sitting in front of me in the therapy room, then obviously they want to work this out. So what is something which because of which they are coming together and doing the session? So kind of very in a very subtle way, nudging them towards bringing out their strengths of the relationship. Active listening is again very important concept which need to be enhanced also from the positive psychology angle, that how this can actually improve the communication as well. And another examples are again for the clients diagnosed with PTSD finding meaning through community services. Like mentioned, that community plays a very important role, and positive psychology also focuses a lot on how people, how community really helps. In fact, I will define in one of the techniques of resilience, that when we talk about resilience, the concept of resilience in positive psychology, we focus on protective factors. That what are the protective factors which you can identify. So, for example, if I have to ask my client that note down tell me your protective factors. I'll share one of the experience actually which I have found from my research. Here, I would like to mention that my PhD research was in the area of positive psychology, where I was exploring how people who have been impacted by losses in their life have overcome such challenging times, and also built in their strengths. For example, I was exploring resilience, flourishing, and benefit finding, which is again one of the very important concepts in positive psychology. One of my insights from my research, which I want to mention here, especially talking about the resilience and protective factor, one question I put forward to my participants, that tell me about your protective factors. What is the thing which actually helped you to overcome or to navigate through this loss? Many people came with, factors like the hospital, which helped me during my accident, my family, my friends, my colleagues, or maybe my college. So it can be many things. However, if you revisit the examples which I have told, the other external protective factors, something which lies outside you, something which I have to nudge them towards or explore more is internal protective factors. And that is one question which I found myself repeatedly using, which was something which was not actually, naturally coming, that maybe self-esteem, optimism, finding hope are one of the first things which actually they are saying. So yes, this is something which we have to kind of nudge people towards, that despite challenges, you are able to identify the external protective factors, but what are internal protective factors? So in positive psychology, kind of both of the things are taken care of. And another example, like yes, a depressed individual regaining joy by discovering their hobbies. Again, what is being noticed, people diagnosed with depression, that what they used to do is something they don't enjoy doing anymore, because of the symptoms, because of feeling low mood, because of existing cognitive triad of hopelessness, helplessness, worthlessness, that they are not able to completely enjoy the things which they used to do. For example, a client, a very recent, I had a client who used to love making tea in the morning for himself. While interviewing him during the session, he said that I used to make tea for myself every morning before I leave for office. Now the thing is so that I don't get the quality of sleep and I feel so low that I am not able to actually just walk to the kitchen. All I do is to just get ready and leave. But I still, my mind still asks for something. So I just, stop at a coffee shop, grab a coffee and just go to the office. And this is the routine from last almost, a month. And he also said that it's not like I don't want to, I really feel like, but somehow I just don't know how to do that. So very gradually, while undergoing, sessions, and I also, doing the other little bit of clinical work just to know what exactly the depression score is, etc. We did the activity scheduling, that how we can at least, try our best to have little bit of schedule, if not too strict. And this is one of the first thing which I asked him, which actually with a collaborative understanding, he said that I asked him what is the minimal thing you can start, which is at home, nothing much. He said, I think I can make tea. So I said, okay, let's do that. And that example came actually while it was my evening and it was his morning, and I was having my evening tea. And while having, he said that I can notice you are having tea. Why don't I also? I'm thinking that somehow I used to love tea. I can start making it. So I said, okay. So that is one of the things which we have actually put in the activity schedule. That why not to revive certain hobbies which you used to do before. So these are some of the things which we actually emphasize on activity scheduling, not just the plain, the plain getting up in the morning and shower and etc. PERMA is a very important model when it comes to positive psychology. I'll talk about it more in the next slide. It's given by Seligman. PERMA model, these are called the building blocks of well-being. PERMA is an acronym for positive emotions, which talks about joy, contentment, interest, love, etc. Engagement, which is a flow state, absorption in the activity. One of the very beautiful techniques one of the very beautiful concepts actually of positive psychology, that how one can actually feel so much engaged and get into those flow states. Few of my clients have defined these flow states while they actually use their painting, while they do painting, adult coloring books, mandala. They find that very engrossing and kind of go into those flow states while doing that. Crochet is another activity which I found few of my clients finding very useful. And even journaling in very few cases. Yes, journaling can also create some kind of flow state if you are expressing your emotions and kind of in a very directed way, not a very non-directed way, but yes, in a little bit of directed way, has found to also increase those flow states. Relationships, like I've already spoken about, relationships are very important. Healthy social connections are very important, counts as protective factors as well for a client. Meaning, having purpose, belonging to something larger. Meaning in life is again another very important concept, which Seligman has included in the PERMA model. And last is accomplishment, having a sense of achievement and mastery. So many of the interventions in positive psychology are also based on the PERMA model. So I'll go over one by one, telling you some of the experiences which I have found in my clinical practice and how I use journaling. So one is gratitude journaling. One of the very powerful techniques. I use it in a little bit of directed manner, I would say, because what I have come across that many of us like to do dear diary, right? Like just picking up a journal and writing our thoughts, writing what happened in a day. But sometimes as a technique, it is not very, very useful because it can lead you to either negative emotions, you can end up feeling not very, not sure. You may just end up feeling very heavy after just pouring out all your day if it was a bad one. So I think one of the things which I found it to be very useful to make it little directed. So for example, one thing which can be used is regularly noting down 3 good things that you are grateful for. So this is one of the questions I put forward, and one of the very good techniques, that write 3 good things or 3 blessings where you felt that they happen really good today. And it is a day-to-day thing. It is not something that 3 good things in a week or 3 good things in a month. It is a very 3 good things in a day. Why it is found to be useful? It is one of the really good activities to ground people in day-to-day activities. Either the mind is living in the past or the mind is living in the future. So why not to bring the mind in the present? So in the present, noting this down, this thing really helps. 3 good things, while mentioning that, some of my clients actually wait for the good things to happen. For example, big good things, promotion, and having the changing jobs or buying a house. But actually, that's not the case should be in this activity. You can note it down very, very small good things which happen in your life. For example, you had a very good meal, or you had your meal on the on the time you wanted, or you woke up very early, or you got a call from an old friend. it can be actually very simple, and that is something the instruction should be, that it should be a very simple gratitude exercise. And it helps in focusing the attention on the positive, countering the negative bias. Now, this is the very important concept of negative selectivity bias, where our brain is kind of wired to think negatively. And this concept, as we all know, is coming from the evolutionary psychology. When the man used to live in the caves, have to be on the toes all the time because of the risk and the unsecure environment. However, as the time grew forward, many advances happened, but our brain somehow remains same to have that negative selectivity bias. So in order to in order to break that negative selectivity bias, very intentionally, these techniques are also built on that concept. And this is one of the things which, when I integrate positive psychology concepts in my clinical practice, I do mention about the negative selectivity bias, so that the people, they should understand that, okay, from where these negative thoughts are coming at all. So mentioning this concept also really helps. And there are several studies which links activity of three good things to increase happiness, better sleep, even improved physical health. Another thing where this gratitude actually can be used is writing, letter as well. Writing a letter of thank you to someone whom you felt very, grateful for. So this can be very subjective, can differ from person to person. For example, I had this one client who actually was looking for a job shift from long time, and finally got one through some sources, and he was quite grateful for it. And he did mention in the session that I am feeling really happy. I'm feeling very grateful for this, and I dropped a nice thank you message. So I said that why don't you write an email rather than writing just a small text of thank you. Is there any thoughts you want to mention? And he then ended up having a good long paragraph and how it was difficult and how really he want to say a big thank you. And so that came out to be really beautiful, that the person felt really satisfied with the kind of gratitude which he shared. So this can be used like that as well. Coming to acts of kindness, this can actually help in spreading the positivity and also feel the boost. For example, intentional act of kindness towards others, big or small. The word intentional is very important because it is something which is done by a very good conscious choice. For example, act of kindness can again come from, for example, I had this client who was who said that I am feeling very low from some days, and it's not diagnosed. I mean, she was not diagnosed with depression, but it was because of many other things around. She said that I was feeling low, I'm feeling very hopeless in life. I don't know, I just don't feel like that, will to somehow, it's just everything feels so dull. I said, okay, so is there something which, which you feel that brings happiness to you in any way or used to? She said, I actually love dogs. Like I love dogs, and somehow I love to feed them. And I know a place here which is very nearby, which actually have these foster dogs and dogs for adoption, and I really love that. So I said, is there something which you want to do for them? So she said, yes, actually I can. I can probably, there are some days decided where you can take care of them. And then she ended up doing that, and she felt really, really, really happy with that. And probably that act of kindness, and maybe, one of the therapy techniques, animal assisted therapy, that is also something how, animals can bring lots of positive emotions. It kind of worked in I think both the ways, that act of kindness or, other things. In many other places, you can actually see act of kindness. For example, random compliments, volunteering, like this was one of the volunteering work I shared. There are many other volunteering activities available. Small unexpected gifts, for example, can be act of kindness. For example, this one of my clients was there, and I could see the progress very gradually, and there were good things which we were noticing, which was happening. So, and we were talking a lot about one of the journals. So I got that journal. I said, okay, let's do this journal. And somehow that felt very useful for him, and he said, yes, this is something which I really like. So it can come from both the ways. The example which I just mentioned, that it can come from a therapist also. It's okay. I mean, that act of kindness towards the client can come from a therapist, so that you can nudge your client also towards having those acts of kindness. And lots of research showed that it boosts happiness in the giver, the person who gives, also in the person who receives. It creates good social connections and also reduces stress. One can also identify the signature strength. One of the very famous concepts in positive psychology, character strength. BIS survey is there, which is also available online. One can take, and you can identify the top character strengths which are available. And some of the examples are creativity, humor, perseverance, love of learning. And it focuses on using these strengths in new and fulfilling ways, both personally and professionally. So in order, sometimes I come across, these my clients, and they tell me that, okay, you are asking us that what is good thing and what is, what are our strengths? Can you identify my strengths? I do identify and tell them that, maybe these were the instances where I felt that you were hopeful, or these were the instances where I felt that you have used humor very beautifully, and look, your creativity is showing here. But one can actually use this survey as well, where actually it can objectively also identify that these are the strengths which are there in you, which can be even more, like a proof or like a validation which you receive. So, and it's a very good tool to be used as well. In many other ways in positive psychology, actually, these strengths are explored either through the conversations, but also through, as you move ahead in the session, how they are, interacting with their environment also helps to explore the strengths. One of my favorite technique is savoring the moment, coming from the school of mindfulness as well, which talks about mindfulness for everyday joy, paying full attention to the present moment with openness and curiosity, actively savor the positive experiences using all the senses, for example, sight, sound, smell, etc. And it also found to be helping in combating the our brain's tendency to dwell on the negative. For example, in savoring, as simple as having a cup of tea, how you should savor it, having it slow, holding the cup, kind of feeling the warmth of the cup, and sipping the tea, how it makes you feel, the warmth you feel. This is one of the things which can be done. Or maybe another technique for, again, savoring that, savoring the particular song which you like, just listening to the beats of it, and listening how, just going with the little bit of flow, just observing the environment, observing how the wall, the color of the wall. It's like, many other things which can be done. So it's like slowing the moment completely. And especially these days, the way we all are living in a very fast-paced life, it becomes even more difficult to bring that slowness. So I think savoring is one of the things which really, really helps. For example, this is one thing which I suggest to a few of my clients, that why don't you go for a walk in a park, if it is a nearby park, or on a Sunday morning, go for a walk and just look at, the trees around, just look at, the roads around, and try and see how it is making you feel. I'll quickly share one example here. I had one client who was diagnosed with OCD, but not not very extreme form, a very different one actually, where he used to kind of focus on lots of things, like there was pathological doubt in some form, but there was another symptom which was present, where he used to make shapes in different forms wherever he sees, and we were very confused with the diagnosis initially. We started taking medicines as well. But he used to make shapes in his environment. For example, you see those design tiles. So he used to make shapes and get scared of something. He used to see the mannequins in the market, and he used to get scared. The trees, the clouds. For example, if you remember that we make shapes in the clouds, we used to make, get scared of that. While doing the therapy, I suggested him one thing, that why don't you go to the park? I know that you enjoy walking. You will see the trees there as well. So kind of see that, how you feel, how wind makes you feel. Just take a walk very, very slowly and click one picture. Click one picture of a tree or some moment which you really like. Just kind of, what is the color? What is the color of the nature? What is something which you're liking? Write a sentence and send it to me. He did that over 3, 4, 5 days. He did that, and somehow that really brought that little bit of change, that yes, I'm focusing more on the color of the trees, I'm focusing more of how the freshness it is bringing rather than the shapes of it. I know it may sound very, very simple, but it's just that using it with the traditional approaches really help. Now, since I have mentioned the pictures, I'll tell you how other ways I can I use pictures as bringing some positive emotions. For example, I have this client who is struggling to adjust in one of the new places where he is doing an internship. And while building activity on many other techniques, I suggested that why don't we decide one day in a week where we decide that send one picture to each other, a happy moment of our life. And we decided Thursday, and we named it as Thursday Throwbacks. So every Thursday, he sent one picture, I send one picture, and it is it can be of a glass of a nice juice you are having, a cup of tea, or maybe of a travel, of a road you're watching, of a diary, anything random, something which you were really enjoying. Because I of a park, of you're taking a walk and you saw something and send the picture. So that really also brought positive emotions. And there is one model, I'll just quickly go over it, that Broadburn model of resilience, which talks about, this is one of the worksheet I give to some of my clients, that why don't you fill this, and I have I am and I can. I'll just quickly read the description. For example, I have focuses more on the external supporting systems that provide support, like trust, role models, etc. I am is the internal attribute, the internal qualities of the person. I can is the skills and the abilities, what person is capable and enable, to, for example, the coping strategies. So using this can also one can explore the strengths that you have external support, you have internal attributes which are helping you, and you have the skills. So while doing this in the sessions as well, I have found it in this really very useful. Another very good technique is best possible self. One of the first questions after the first session, I try to give it to my clients, not all, but wherever it is applied, I do give. That write down a paragraph on the best possible self, like take a moment, imagine your life in the future. What is the life you can imagine? And I divide them into the areas, for example, career, academic work, relationship, hobbies, and health. What would you think that what will happen in this area? So when they come up with this particular answer, I set up certain therapy expectations. For example, at the end of the session, what are your therapy expectations? Once they note down the therapy expectation, after that, giving this particular question from the School of Positive Psychology, I found those therapy expectations to be very much rich and details, and a lot of details come out of this question, that where actually they want to go. And in order to build the therapy, in order to use the techniques, this is something which is very useful for me as a therapist to understand this is what my client wants and this is what my client wants to achieve in the future. So building techniques based on their, to navigate through that process is very useful. Positive affirmation, self-affirmations, again, very useful technique. For example, I am in the right place at the right time, doing the right thing. So one can actually use these kind of sticky notes. So this is one of the things which I tell them, use sticky notes, write one positive affirmation and stick it on your wall. You can do that every day for next 5 days. So it doesn't have to be very repetitive. But yes, every weekend, just write one and put it across. So as per the client's need. One thing which I have found to be very useful, writing one positive quotation, affirmation, note, anything which need to be either a little bit positive, something which you want to tell it to yourself, something which you want to read, the morning, the first thing in the morning you want to read that. Write a quote, keep it on your bedside table. As soon as you wake up, spend, at least 2 to 3 minutes by yourself in the bed. And that is the first thing, you just pick up that note and read. Nothing else, no analysis, nothing, just visually read it. This is something also found to be very, in a very subtle and in very its own way, produce some positive emotions in person. So this is how the positive affirmation can also be used, not just by writing in the diary. Using a lot of visuals really helps, which is again I found to be. I found through these techniques that yes, using visuals really help, like using those flash notes which we use in our IT traditional approaches as well. So yes, positive psychology in clinical practice, why we should actually integrate positive psychology at all in the traditional approaches. Well, it provides a more holistic view of the individual, not just the problem, but the potentials too. And as a belief that as a therapist, which one have that, yes, this client have lots of potential to grow and to overcome the problem they are in. This really helps. This helps them to nudge towards the strengths. This helps them to kind of, giving that message that yes, you definitely can do it. Can bolster the resilience and motivation for change. Motivation for change is again one of the very things which I have struggled a lot with many of my clients, where actually I felt myself stuck with the what else to do, why the person is not doing the homework assignments, and how to make them do. Homework assignments can be made very interesting using these techniques, which I have found that, like for example, I was sharing Thursday throwbacks, and maybe writing that small little note to yourself, maybe writing positive self-affirmation in any different way, and gratitude, like three good things, writing three good things. In fact, some of the clients who don't want to write, I tell them to consciously recall three good things while lying down, nothing else, just be conscious about it. That's all is also enough. So it really helps to motivate, kind of bring that little bit of motivation that yes, probably things can be nudged towards a little bit positive, not just focus a lot on the negative and the problems. It enhances the treatment outcomes and may also prevent the relapse, which is again very common thing which can happen after a point of time, and we can always fall back also to these techniques along with our traditional approaches. And it also brings hope and empowerment to the therapeutic process. This is something which I have found personally in my clinical practice, coming from a traditional clinical practice, and building my therapy also on positive psychology techniques of late from almost last 2 years. I have found certain things to be little different, certain things to be actually very useful. I'll quickly share one. I'll end the presentation by quickly sharing one of my own experience of using positive psychology technique, and kind of sharing it with my clients, and they also found it to be very useful. That one day I remember that it was not a very great day for me. It was a little low day for me, and I was walking across the street in a very new city, and ending my day on a not a very great note. And while walking, I was like, something should be there just to make me feel a little okay, just to make me feel a little happy. And I love to savor my tea, but the tea was also not doing that great work the other day. And I thought, okay, I was just walking around and I saw a flower shop. And I thought, okay, I mean, this shop looks nice. I just walked in, I strolled around, and I saw a very pretty flower, a white color flower. The moment I saw the white color flower, the thing which came to my mind is peace. And I thought that, okay, let me buy myself some peace. And that's how I just, related it with it. I picked it up and I bought it. The person who was decorating that bouquet, I told him, just put the white flower with, if you know the flower baby breath, which are also very pretty ones. Told him put it with the baby breath, and he made it. And he said, it's for whom? I said, it's for myself. And he just smiled, nothing else. I just picked it up and I brought it to the room, and it did brought some peace. I did felt that little bit of peace, and I did mention to myself that, okay, this is one good thing which happened in my life today, that I bought myself some peace, like manufacturing your own happiness. So this is how I think, and I shared it with few of my clients, and they also really liked it and nudged them towards using certain things. So one of the very beautiful thing about positive psychology techniques, ending it here by saying that it is very flexible. You can use it in your own way. Like, it's very creative, like using your creativity and how to build in finding, helping the clients find their strengths is something which I found as a practitioner very useful. I'm still building on it. I'm still exploring it. And it's a very new field here as well. In fact, one of the, now there is a manual of positive psychotherapy given by Dr. Tayyab Rashid. One of the first, I think, clinical psychologists who also kind of became positive psychotherapist and produced this manual, where he talks about a lot of his clinical, cases, and how he integrates these positive psychotherapy. So yes, I find it to be very useful. So thank you, and questions are welcome.
Thanks,
Thank
Dr.
you so
Soumi.
much.
Yeah, so do we have questions?
any question, participants, please, if you have any query, you can type also and you can unmute yourself and ask.
Ma'am, I think there is one
Yeah,
query in the chat box. You can take
yeah,
it up.
yeah, I'll have to take this. Okay, ma'am, there is a query that said, what are your thoughts on positive psychology techniques in trauma focused exposed individual? It is feasible?
Well, we have to see that what is the intensity and what is the severity. Of course, in the initial part of it, it might be a little tough to use, depending on if the grief is still ongoing and if the severity is too much. But yes, there are certain places in which it can be used, in which it can definitely facilitate. For example, after 4 to 5 sessions, when we are working on some kind of scheduling and when we are working of integrate going back into your environment, there I have found this to be very useful for them to notice the support which they are having around of their family, friends, or colleagues who are helping them to overcome. For example, the Broadberg model which I was talking about, or maybe noting your strengths and protective factors which I was talking about. Those two techniques, of course, have been found to be very useful because what happened during the traumatic event, we are so much engulfed with what has happened. However, kind of discount and not able to see sometimes the supporting systems or internal supporting system which we have. So yes, this is something which I found it to be very useful. In fact, the research which I was talking about, my own PhD research with impactive losses, I have found there, many of my participants who have undergone several difficulties actually end up talking about the benefit finding concept, that how I found some benefit in this particular adversity and I learned from it. So yes, these are the things that can definitely be emphasized.
Thank you, ma'am. One more question from the same participant is, what about it adverse childhood experiences?
Well, again, adverse childhood experiences depend, very subjective. However, what I have found again, based on the subjectivity, for example, this one of the client I had who had difficulties in the childhood experiences and have undergone certain issues as well in the family, have also while taking the history of the problem, and they were telling about their childhood issues, etc. However, I was actually asking them this question as well, that okay, since while having a conversation, he spoke that I had a very beautiful relationship with my grandmother, and then I kind of emphasized that little more. Okay, despite all that, so how was that relationship? How that really worked? So finding that little bit of things which really works with them in such cases, also emphasizing wherever it is important, actually can bring out a little bit of perspective of his friend.
Thank you, ma'am. One more question is, how as a counselor we practice positive psychology with school students,
Oh,
especially with 9th and 12th student who
yes.
faces difficulties in studies? Yes, ma'am.
Lot of work has been done actually in this area, and especially in the school mental health and how the positive schooling can really be one of the concepts which can be adapted, and especially using certain techniques with the school children. When some of the techniques which I have spoken about are very much from the therapeutic perspective, but there are certain group interventions also done. Certain group activities are also done at a school level using the positive psychology principles. For example, let's say the technique of best possible self can actually help them to create a picture of an image of an eye. So something, the concept which we talk about, real self and ideal self. So ideal self coming from that positive, best possible self, noting it out, all the stories, noting it out together, kind of picturing, like painting a picture of their ideal self, something which they want to achieve can actually really help. But yes, since I work mostly in the area of adult psychopathology, but yes, there has been some good work definitely done in the area of school mental health as well.
Thank you so much, ma'am. Very nice answer. One more message. Good evening, ma'am. Thank you so much for giving an insightful into positive psychology and its practical usage in therapeutic sessions. More than a question, I had a doubt. How does positive psychology takes into consideration the societal or cultural construct in the life of individual?
Yes, so I think for this, it definitely consider one of the authors' work which you should read is Dr. Michael Unger. His work is in Dalhousie University, Canada. His work has been done really well in when integrating the cultural concept into positive psychology. So definitely, it is very beneficial. He talks a lot about that.
with this, Mustafa Nadim Kirmani sir have given a message that he wrote a paper in 2013 on integrating positive psychology in psychotherapy, work of Tayyib Rashid sir. It is worth reading. So we all can read from there also. Thank you so much, sir. And one more message. Thank you so much, ma'am. Wonderful message. If I allow, I can ask any question. Just one simple question. Ma'am, any like what potential challenges and limitations we while dealing with especially psychopathology and psychiatric patients in psychiatric setup we deal when we'll talk about the positive psychology and intervention.
Okay, so yes, like every approach, everything have its pros and cons. So sometimes it is not very much applicable if the severity is too much. If especially in the say clients diagnosed with depression and anxiety can be used, but if the severity is, let's say, if if the client is on medication and if the symptomatology is little severe, then at that time, obviously, one can refrain from using these techniques because insight is very important to use the positive psychology technique. That is one of the
Definitely.
very important things. So having that insight, having that will to do, having that little bit of motivation to do is important. One can build on a very small little activities like empathy. One can build a little bit of activities in empathy and kindness in a hospital-based setup of, just like, very small acts of kindness can be built up among the patient. Those things can be used. But yes, to have that insight, and if the insight is missing, then obviously it has a little bit of trouble when talking about the positive psychology, along with
Thank you so much, ma'am. Okay, before moving towards sir, I just want to ask if any participants have any query or anything, any opinion you want to discuss. Please unmute yourself and say.
Ma'am, am I audible? Saima ma'am?
Yes, ma'am. Sorry, ma'am. Welcome,
Haji,
ma'am.
good evening,
Yeah.
beta. Good evening. First of all, since you asked for an opinion, I would like to congratulate the organizers and definitely Shikha ma'am. I have been listening to the wonderful lecture that we all have received from you. And as a positive psychologist myself, I would like to add just one point here that along with taking positive psychology and clinical psychology together, if we can take the indigenous approach towards psychology along with positive psychology into clinical practice, because there has been a question here regarding how to incorporate culture and societal norms into positive psychology. So maybe the answer lies here that if we can have the collectivist culture point of view, which is who we all are, and integrate that into positive psychology and clinical psychology, that could make a wonderful combination. And thank you so much, ma'am. What you have been discussing so far is the need of the hour. And I really appreciate the efforts that you all have been putting. Thank you so much.
Thank you so much, ma'am. Thank you. Thanks for your expertise.
Saima, Dr. Mustafa would like to talk to you
Yes,
something.
yes,
He
yes,
has to pass a comment. He
Hello.
has given twice.
yes, yes. So please,
So, yeah. Good evening, everyone. I was thinking, just 1 minute I will take. As clinicians, we have the habit to immediately point out something which is not happening good. Okay. So, I think what is important is we need to change our lens to see what is good happening in the life of a person. Even the language that we use in our day-to-day thing, we always use language like depression, anxiety, OCD, when we know it may not be depression. So what I'm suggesting to those who are young professionals, they have to change the lens of finding out what strength a patient has while he or she is having the negative emotional state. So I think we need to change the lens along with the language to integrate positive psychology into a clinical practice. Thank you.
thank you so much, sir, and welcome, sir. Now, if any other participants have anything to say, before moving to sir's chairing the session, if Zebi sir can give any expert comment on the presentation.
Thank you, Saima. Though Dr. Devrata would be doing a real expert comment, I would be only giving the passing comment. Dr. Soni, extremely happy to see you once again online
Thank you,
and
sir.
heard your very good, very simple, and very meaningful presentation. and it speaks about your understanding of the subject. As so many young professionals and the students are there, just I wanted to highlight few points which Dr. Soni has very rightly mentioned that to start with, perhaps her first sentence was that when the client enters into your room, we starts creating a very negative environment by asking them what is wrong with you, or what is the problem, and why you are here, and all these things. So this is one thing which we have to learn how to appropriately transform from so much negative environment to the welcoming environment, acceptance environment. And this would be only learned by experiences and by discussion with your seniors and all these things. That is one point which is very, very important. Then Dr. Soni has mentioned about transformation from the wrong to strong. A very, very good purpose of positive psychology. And perhaps if you could learn and if you could make your client transform into his, your target is achieved. And the example of resilience which she has given through an spring, that no matter how much you stretch and no matter how much you suppressed, the real good spring will back to the same status, and that is the uh, a real resilience. So many very good practical tipping and tips and antidotes, and I'm sure that the student will be benefited and young person. Over to Dr. Devrata for your expert opinion.
So,
Thank you, sir. I think you eased my work. You summarized it so nicely. Um, yeah, first of all, I must thank Dr. Soni for being so lucid and simple. Um, I think that that's a good speaker's characteristic, where you bring all the research things into a simpler manner so that everyone understands. That's very good. Um, now, as I think Jati sir was telling, is that, see, what I think all of us practice positive psychology. When you do clinical psychology practice at different degrees and level, first thing that we need to understand is that it is not, it's not a standalone therapy or something. So it's not that if you are doing working on some positive aspect, you are not doing CVT. Rather, within CVT, you can include, and we include, for example, I give you one example. Sometimes when I work with my patients with depression, and when I have to work upon activating them and realizing that there are small happinesses in your life, you need to you need to identify them. I just give a simple example that you keep some 10 bits in your left pocket in morning, and if anything which makes you happy, you transfer one bit from left pocket to right pocket, and that could be anything. For example, if your breakfast is satisfying, you just transfer one bit because it made you happy for that moment. Or if your child says bye and you feel happy, you just transfer another bit, and then perhaps by afternoon your left pocket will be empty, which essentially means that so many happinesses came in your life within couple of hours. You did not realize that. You need to pay attention to that. So or when we talk about resilience, you know it's like when say for example natural disaster happens, you will have three types of people. One who will be very distressed, having all kinds of extreme reactions that they will have, not dramatizing. It's the fact that they have gone through those trauma. Then you will find that there is a group who is not asking for something but not contributing also in a very active way. They are kind of in a state of shock, and you will find that from that rubble, from that distress, a group emerges who starts helping others. All three groups have gone through the same trauma. So there are, we have our own resilience, we have our own positive aspects of personality, which, as Dr. Kirmani was telling very rightly, he said that you know we seldom pay attention to that. We do not pay attention to that. We have our own resiliences, we have our own positives. um, so I suggest all those who are practicing clinical psychologists, that you integrate these aspects into your regular practice. You do not need to treat it as a standalone treatment or something. You just integrate it into this one, and let people identify their positives, let people identify their strengths. Not that they should not identify the limitations that they have or the things on which you have to work on, but how you can build upon the positives is something that is our skill, which we should be utilizing that. And finally, I must say that what Seligman has done to the field of psychology, or what Maslow has done to the field of psychology, where all of them have, helped us to identify the positives of our life. I always tell my students that we should learn from the life of Abraham Maslow, who suffered a lot as a child. His anyone who is a bit interested in understanding how is what kind of strength and resilience human personality can have should, before reading humanistic psychology, should read the life history of Abraham Maslow, the kind of negatives and sufferings that he had as a child, the kind of discriminations and everything he felt as a child. And then this man says that man is innately good, which essentially tells that even after being suffering from so much of negatives, you say that man is innately good, for one or other reason he or she behaves in a negative manner. uh, so I first of all, I really thank the organization and Dr. Soni for talking about something which is so relevant. It was relevant always. We keep telling that it has become so relevant nowadays. Nothing like that. Always there is a role of this one. Time changes, and we feel that we are at the crossroad of crisis. Crisis was always there. Crisis will remain always there, and was always there. Resilience will remain always there. It's up to us how do we realize that and how do we utilize that. So I thank everyone. Yeah, thank you so much.
Thank you so much, sir. So there are a lot of questions for you also. Excellent pocket example, Dr. Kirmani sir said. And everyone have thanked you and Dr. Shikha ma'am. You also. Lot of very nice messages are here.
Thank you.
Now, I like to invite our organizing secretary, Dr. Syed Sajid Kazmi sir, for vote of thanks.
Thank you very much, ma'am. I hope I'm audible.
Yeah.
Yes, yes.
Yeah. So, without going into a lot of customaries, since we are here after the whole hectic day, and at the outset, I'll be extending my gratitude not only from my side but from all of the organizing team to our speaker, Dr. Shikhaji, who has spared time and who has very kindly accepted our invitation and delivered a lot of insightful information here. Not only information but also a lot of strategies. The takeaways are here. So I'm sure that all my students, all our young generations, and even me, and now I'm in a better position to understand and to implicate all those things, not only in my professional life, but also in my personal life. Uh, I am very thankful to Devras sir for accepting our invitation, and thank you very much, sir. You have been very kind enough, very polite enough that just one single message from our side and you have considered our request. So we are grateful that you have obliged us. And again, it's a promise that we will be troubling you again and again for your mentorship and guidance, sir. Same applies to you, Shikha ma'am. We will be looking after and troubling you on and off because this is a monthly series. So we will be coming up with a lot of insightful sessions and we will be seeking support from all our seniors in the field for insightful lectures. Last but not the least, thank you very much, Zaidi sir, for being with us, for guiding us on each and every step. And sir is still here with us. So it just says and it shows his dedication towards the field, and we should all be following his footsteps. Our wonderful audience, we extend our thanks to you as well, and thanks to you that you kept the session very lively because we were afraid that if there are no questions, that our purpose will be futile. So there are a lot of questions, there are a lot of remarks and queries. That means that our message has been conveyed properly. So thank you for being a wonderful audience, and thanks a lot. Sir, would you like to say anything, or we can end up the session now?
Can I just say a word? Thank
Definitely, ma'am.
Thank you so much, everyone, for organizing this. And Devra sir, thank you so much for the beautiful examples. And Reddy sir, thank you so much. It was really good to meet you again. I'm really happy. And thanks a lot for this opportunity. I'm glad that I could share the insights from my therapy room and would love to share more insights. Thank you so much.
Definitely.
I would like to say just one word. I mean, I must appreciate for this effort that you people have done, because we come across too many negatives every day about profession, about so many things in our life. But such positive efforts are very appreciable. That, and all of us contribute to the society at the end of the day. So I'm not doing anything for you. I'm actually doing for society. And what you are doing, you are not doing any favor to anyone. You are serving the society. So I'm really thankful to you. Thank you so much. And it must be mentorship of sir that you people keep organizing this kind of programs.
Definitely,
Yes.
sir.
Thank you so much. Yeah.
Thank you very much, Devrat. Thank you, Shikha. Nice meeting you, and hopefully we'll meet once again through this platform.
Yes.
Thank you. Over to Simon.
Thank you. Lastly, thank you so much, everyone. Dr. Devrat sir, Dr. Shikha ma'am, Zaidi sir, always mentoring us, always be there with us anytime, anywhere. Dr. Soni ma'am, who is there, Dr. Nadeem Kirmani sir. Thank you so much, everyone. We'll meet again. Thank you.
Bye.
We can end.